You're brushing twice a day, you're flossing sometimes, but your teeth are still sensitive or stained or something is just off. The truth, some of the worst things for your teeth aren't even on the radar. And the thing is, a lot of dentists won't even talk about this unless you ask them. But in this video, I'm gonna go over 7 surprising things that are ruining your teeth that most dentists won't even talk about. Let's start with a sneaky one that starts before you even get out of bed. It's mouth breathing while sleeping. Yep, you heard that right. Breathing in and out of your mouth instead of your nose while you're sleeping. The problem here is when you breathe in and out of your mouth, especially when you're doing it for like 7 to 8 hours straight, it's drying up all the saliva in your mouth. Now your saliva is really important. It's like a natural bodyguard for your teeth and your gums. It carries a lot of minerals that are important for our teeth. It helps neutralize the acids in our mouth. It helps keep our teeth and our gums clean. And people that don't have enough saliva are way more likely to get cavities and gum disease. And not only that, when you have a dry mouth, your mouth is gonna smell way worse because when you have a dry mouth, it's like a bacteria party in your mouth and on your tongue. And you're gonna have that morning breath. So if this sounds like you, what you can try is a couple things. You can try using a nasal strip, like a nasal dilator, to help make it easier to breathe in and out of your nose. And you can literally use any medical grade tape. The tape I like to use is something called 3M micropore paper tape. Literally a medical grade tape I tape over my lips, and it helps encourage nasal breathing. And not only is this stuff gonna be good for your mouth and keeping your teeth and gums healthy, it's also gonna have a lot of other benefits for your sleep and your cognition and just breathing better. And I talked a lot about mouth breathing versus nose breathing in some other videos, so I'm not gonna go into too much detail here, but check out the description below where I put some other videos where I talked about that. Number 2 is snacking all day long. You might think snacking is harmless, especially if the foods are healthy, but here's the problem. Pretty much anytime you eat anything, your mouth is going to get acidic. Are there exceptions? Yes, like celery or broccoli, those are gonna be fine for your teeth, but who is gonna be snacking on that stuff all day long? When people are snacking, they're probably gonna be snacking on like goldfish or Cheez-Its or things like Wheat Thins or all these other carb-heavy, starchy foods. And even things you might think are healthy, like granola bars or all this stuff, they still have carbohydrates in them. The problem with these specific types of carbs is they can cause cavities, just like sugar. The way cavities form is you have a bacteria in your mouth called Streptococcus mutans, and these bacteria will eat the carbs that you put in your mouth, especially these refined, starchy carbs. And in turn, they will poop out acids. We talked about how acid is bad for your teeth. And this is why, because when that acid sits on your teeth, it will literally dissolve them and cause holes to form in your teeth. Or in other words, cavities. Now, the biggest problem here isn't even the fact that you're eating these foods, it's the fact that you are frequently eating them. The frequency is what matters. So if you're constantly introducing these foods into your mouth, the problem is you're not giving any time for your body or your teeth to remineralize. This is where your saliva comes in again. When you eat a meal and you wait some time before that and your next meal, your saliva has time to build up and kind of clean your teeth and remineralize them. But if you keep snacking on foods and you don't give much time for your saliva to build up, even if you just eat a little bit, like one bite of a granola bar or a few goldfish or something like that, you're still going to be introducing these carbs for those bacteria to eat and then release more acids. And you're not giving your saliva time to build up enough to clean that away. So the best thing you can do is stick to just eating at meal times and give your saliva time to build up in between them. And if you do want to have like a snack or a soda or something like that, I'm not saying to not eat those foods or never drink something like that in between one of your meals, but a good idea would be to like swish with water or something afterwards to kind of help dilute those acids a little bit. Number 3 is overusing whitening toothpaste. Now, is this something that's going to cause cavities and basically destroy your teeth? I don't think I'm gonna go that far because you're still brushing your teeth. You're still using toothpaste, which has good stuff in it. But the problem with whitening toothpaste, which is different from like a whitening strip, is whitening toothpaste usually are just polishing your teeth. And the problem here is they can get pretty abrasive because the way that you whiten your teeth from a whitening toothpaste versus whitening from like a whitening strip is the whitening toothpaste is actually polishing those stains off. And you're actually kind of removing a little bit of enamel if you do it too much. But if you just do the whitening strip, you're not actually removing any enamel. You're actually just kind of changing the structure of those stains so that when light passes through your teeth, it looks more transparent, your teeth look more white, yada, 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 but you're not actually removing your tooth structure when you use like a whitening strip. But if you only use a whitening toothpaste all the time, this can actually cause more damage than using that whitening strip. Pretty surprising, right? Now, if you don't do this all the time, I don't think these whitening toothpastes are that big of a deal, but I think it's good to interchange with a more gentle, like regular toothpaste. So I think the toothpaste that I use is like a Colgate Total Protection. It's like, has like something called stannous fluoride in it, which is really good for your teeth and your gums. And to be honest, I never really use a whitening toothpaste. The only time, if I wanted to whiten my teeth, I would just use a whitening strip. And honestly, I think it'd be better just to use a whitening strip like once a week rather than try to whiten my teeth with a whitening toothpaste, because I don't really think the whitening toothpaste work that well anyway. Number 4 is drinking sparkling water. So if you're the type of person who never can drink water and the only form of water you drink is sparkling water, the problem here is it can make your mouth more acidic. Now, I know I might be triggering like half the internet right now because so many people love sparkling water, but you cannot use it in place of normal water all the time. I mean, you could if you really wanted to, but if you constantly sip on this, it's gonna keep introducing an acidic drink into your mouth. Now, it might not be acidic enough to actually destroy your enamel, but it's going to put your mouth at a resting lower pH. So let's say your mouth typically rests at a pH of like 7. But now if you keep drinking sparkling water, it might get closer to like 6.5 or 6. Your enamel will start to demineralize or break down at a pH of 5.5. Now, if you've been exposed to fluoride, your enamel's a little bit stronger and it'll start to demineralize at 4.5. But your dentin, or the inner layer of your tooth, or your root structure, like underneath your gums, that can start to break down at a pH of like 6.5. So it doesn't even have to be that acidic to start destroying your dentin or your root structure. And if you're the type of person who has thinner enamel for one reason or another, like if you've been grinding your teeth, or if you've been brushing your teeth super hard, or if your gums were receding and your gums pulled back and now your root structure is exposed, that can start to wear away. And on top of all that, if you introduce other acidic foods and other acidic beverages, then your mouth is going to get to a lower pH even quicker. So your teeth are going to be more susceptible in a more acidic environment nonetheless. So I'd recommend obviously trying to just stick with normal water, but if you have to drink sparkling water, look for one that is like pH balanced so it has a higher pH, or try to like swish with normal water in between every now and then. Now, number 5 is brushing your teeth right after eating. It's another thing that not many people talk about, but it's not really that good for your teeth. Obviously, brushing your teeth is good, but if you do it right after eating, you can probably guess what the problem is, especially because we talked about a lot of this stuff before. So anytime you eat, your mouth gets more acidic. Now, when you introduce a toothbrush and toothpaste that has some abrasive stuff in it and you start brushing your teeth, your enamel is actually weakened in this state, and you might actually do more harm than good. Because what do you think would happen if you wait like 30 minutes to 60 minutes after you eat? Your saliva will start to build up. And we talked about your saliva before, but when your saliva builds up, it can help keep your teeth clean, it can help remineralize and kind of dilute those acids. So now your enamel will be a lot stronger. And if you brush and use that toothpaste against your teeth now, it won't really damage them at all. It's only gonna clean them. Now, something else I like to do as a little bonus after meals is chewed gum, specifically something that has xylitol in it, because xylitol is actually the only sugar substitute that actively prevents cavities. When you have xylitol in your mouth, those bacteria, those Streptococcus mutans bacteria that cause cavities, when they eat the xylitol, they die. So instead of eating like sugar, how they'll poop out acids, now when they eat the xylitol, they actually die. So the xylitol is really good for your teeth as well. But also if you chew gum after a meal, it stimulates more saliva. So now you're gonna dilute these acids even quicker. Now, number 6 is clenching or grinding your teeth. Now, sometimes your dentist might have talked about this, but a lot of times it's still ignored. A lot of people clench and they grind their teeth, whether when they're sleeping or when they're driving or when they're focusing on something or when they're stressed out about something. This can lead to a lot of problems with your teeth. One thing it does is kind of thins that enamel. So we gotta imagine when you keep rubbing your teeth back and forth over and over, you're gonna keep stressing out that enamel, and eventually your enamel is gonna get really thin, and then you can start exposing your dentin. And this can make your teeth more likely to crack or fracture or get cavities. And this can even lead to like jaw pain because you're just constantly stressing out that jaw joint. Now the problem is you might not even realize that you're doing this. So when you're going to your dentist, you might even wanna ask them like, hey, do you see any signs of me grinding or clenching my teeth? Because you might not see any cavities, and the dentist might say like, hey, like this is no big deal, like everything's fine. But if they do see signs of that, you might wanna look into getting a bite guard. A bite guard is basically like a mouth guard that just goes over one arch. So now if you ever grind or clench your teeth, it basically deflects those forces and it protects your teeth. And this will basically be like a long-term insurance plan for your teeth. Now, quick side note, I did make another video more about grinding your teeth at nighttime and how it's more related to like your sleep and your breathing and what you can do in regards to your sleep to help fix it. So if you want to learn more about that, check out the description below. Now, number 7 is skipping your dental cleanings because nothing is hurting. This is something that sneaks up on people quite a bit. And there's a chance your dentist might have told you, but if you're already skipping your dental cleanings, then you either don't remember or you just don't listen to your dentist in the first place. The problem with this logic is cavities and gum disease and all these problems in your mouth, they don't really hurt until they get to a really bad point. So once you have dental pain, if it is actually from a cavity or from gum disease, that usually means that it's gotten pretty bad. Now, can there be other causes of dental pain? Yes, but we'd only know that if you actually come to the dentist every 6 months. It might seem like a waste of money if you don't have insurance, but you actually save time and money if you catch something really early or even prevent something from happening in the first place. Yes, we can actually prevent cavities if we catch it early enough. So sometimes when we're taking an X-ray, we can see like a cavity that's just starting off, but it hasn't really fully formed into a cavity yet. In these cases, we can still remineralize that cavity with like fluoride or even potentially hydroxyapatite if you want to use that and help strengthen that tooth so it doesn't actually turn into a cavity. But if we never see you and then we wait like 4 or 5 years and then we see you, then we might not be able to prevent that from happening, and then it could have turned into a much bigger issue. So the moral of the story is even if you feel fine, it's still good to go to the dentist and get everything checked out. And also just to get your teeth cleaned because it's kind of gross when you don't. Now, if you made it to the end of this video, your teeth are probably thanking you right now, even if you can't hear them. And if you haven't already, don't forget to hit that thumbs up button and subscribe to my channel below, and I will see you guys in the next video. Hey guys, I've talked about dental implants before. We literally screw an implant or a titanium screw into someone's jaw to replace a tooth. Now, this is becoming a very common procedure, but I thought I'd show you exactly what it looks like from start to finish to actually place an implant. Now, disclaimer, this is actually showing a surgery, so you will see blood, you will